So let's see regarding the part of cancer. Okay, so what is cancer? Cancer ante entante, so this disease will allow the cell to divide continuously, like uncontrolledly. So it gives rise to some mass of cells, we call it as tumors. So because the loss of regulation, so it will cross the G0 phase. So G0 phase is lost and the cells will be continuously dividing. So the second leading cause of death is cancer. Second leading cause of death. So mostly in the industrial countries, and the most common cancer you will see is mouth cancer, who will be using this carcinogens. Throat cancer, lung cancer, for females uterine cancer, cervix cancer, mammary gland cancer, like this. So in the cancer, the tumor is also known as neoplasm. So tumor is equal to neoplasm, and it is again divided into two categories. One is benign and other one is malignant. Benign is normally confined to that original location. And do not spread to other parts. But when it comes to malignant, no, the cells will grow rapidly. And damaging the surrounding tissues. So it leads to damaging the surrounding tissues. So malignant tumor will show a property called metastasis. So where some of the cells will slug off from tumor and it will passes through blood and it will start a new tumor again set somewhere. That is metastasis. And normal cells, because of the heritable genetic change, spontaneously will convert into neoplastic cells. Normal cells will transform to neoplastic. Normal to neoplastic. So we call this as oncogenic transformation, neoplastic or oncogenic transformation. And the study of cancer, we call it as oncology. The study of cancer is oncology. And discovery of underlying this mechanism, like this transformation, mainly we have to treat the cancer and control the cancer. So the treatment of cancer, RX, which means treatment, and controlling of cancer in case of metastasis. So it will not have the absence of contact inhibition. So what is contact inhibition is, usually normally the cells will have this property. So because one of the cell will not divide, the other nearby cells also by contacting, that also will stop dividing. It will be lost by this contact cells. So contact with neighboring cells, but cancer cells will lose that mechanism and the continuous growth will be produced. So this thing will be absent. And we have one more property called metastasis. in which the cells of malignant will slug off and will go through the blood through other areas and start the new tumor there. This process we call it as metastasis. And next, coming to let's see the difference of two categories. We have normal cells, cancerous cells. So coming to the normal cells, so the normal cells will grow, divide, but later die. Shows mortality. So shows mortality. So in this says they continuously divide indefinitely, shows immortality. Shows contact inhibition. So there is no contact inhibition. So nucleus is normal in size and shape. Nucleus is normal. In this case, nucleus is large. So let's see the other thing, causes of cancer. So coming to the causes of cancer, mainly the neoplastic transformation is caused by carcinogens. So whatever the things which causes the cancer, we call it as carcinogens. So we have physical. So physical carcinogens, we have the X-rays, gamma rays. These are ionizing. Coming to the non-ionizing, we have UV rays. These are non-ionizing. So they will damage the DNA. So that's how it leads to carcinogenic. And next we have the chemical. For the chemical, tobacco is highly carcinogenic. And such as nicotine, it has many things, mainly nicotine, formaldehyde, halogenated hydrocarbons, benzapirin. So we'll just remember this thing, nicotine. So nicotine. So usually the major cause of lung cancer. Many chemicals, we have mustard gas, vinyl chloride, all these things we call it as chemical carcinogenics. Next, biological. So coming to the biological carcinogenic, it may be intrinsic or extrinsic. Extrinsic will be such as RNAs, certain RNAs and DNA viruses. So we call that as oncovirus. Causes cancer. And there are certain virus also, for example HPV, human papilloma virus, so RNA retroviruses. And we have hepatitis B. Hepatitis B usually causes liver cancer. So human papilloma virus will cause cervical cancer. So this RNA retroviruses causes leukemia, blood cancer. So intrinsic biology will be like So, like alteration in the set of the genes, like cellular oncogenes, so tumor suppressor genes. So these and all will be seen. We have one protein called cyclin dependent kinase. So it leads to mutation also, several years of cloning of cells. So usually and the cellular oncogenes, so we call it as proto-oncogenes. So they'll amplify external signals, and so far identified is 60 oncogenes. The proto-oncogenes under certain conditions bring about oncogenic transformation, which is positive effect on cancer. Such activated oncogenes are dominant over the normal alleles. And in another case, the tumor suppressor gene code for proteins will be turned off for cell division in healthy cells. So that will be against the uncontrolled division. The inactive carcinogens helps in DNA repair actually, and immune system to attack. Hence, the genes we call it as negative effect for cancer. So coming to the cancer detection and diagnosis. So coming to the cancer detection and diagnosis, the cancer treatment is surgical. Usually they'll go with surgical treatment. So the test will be by biopsy. Mainly the diagnosis will be done by biopsy or histopathological studies. So they'll take a piece of tissue removed from the body and cut into a thin section as biopsy, and they'll stain it and observe the microscope by the pathologist to observe any neoplastic anomalies are there or not, or any abnormal morphology, cytological features. So like blood bone marrow cancers, they'll increase the cell count actually. Histopathological studies and pap smear, so like cervical cancer, so particularly pap smear is the test. This is for cervical cancer. So even cancers for mouth, throat, liver, stomach is also done by biopsy. And next, radiography, CT. So by using X-rays, they'll detect the cancer. So usually for lung cancer, CT scanning will be done. And three-dimensional imaging will be taken, CT, MRIs. And magnetic resonance imaging. This will be using the non-ionizing radiations also to accurately detect the pathological changes in the living tissue. Next, immunodetection. In case of this immunodetection, so antibodies against the cancer specific antigens will be detected. So detect the antibodies against cancer specific antigens. So usually used is monoclonal antibodies. Next, molecular identification. So in case of molecular identification, they'll take PCR. So used to detect the genes in individual with inheritable susceptibility, and higher susceptibility of having cancer are mainly smoking, alcohol, and excessive intake of fat will prevent the colon cancer. So helps in preventing in such cancer. So avoiding tobacco for lung cancer, avoiding alcohol which leads to liver cancer, avoiding excess of fat for colon cancer, all these things has to be avoided. Next, treatment. Coming to treatment, we have radiotherapy and we have the chemotherapy. So radiotherapy and most of the malignant tumors can be removed completely through surgery. It does not cause damage to the vital organs. To eliminate this metastasis cell, surgery is followed by radiotherapy as well as by chemotherapy. So now we are going to see about cancer. The causes is radiation. In the radiation also, ionizing radiation is UV and gamma rays. Non-ionizing is X-ray. Non-ionizing will be of UV rays. Ionizing will be of X-rays and gamma rays. Chemicals. There are certain, for example, tobacco. Tobacco have nicotine. So these things will cause the chemical cancer. Biological cancer will be found by oncogenes and oncoviruses. So mainly by detection will happen by biopsy test. Biopsy, they'll take a slice of the tissue and they'll send it for histopathological studies. And through CT, MRI and X-ray, through radiological studies also we can detect the cancer. Surgery will be the first option. If not surgery, they'll go with radiotherapy, chemotherapy, hormone therapy, and monoclonal antibodies and alpha interferons. This is the treatment. And next, coming to the AIDS. The cause is HIV. And PCR, ELISA, Western blot. Western blot is the confirmation test for AIDS. So this is confirmation. And here we have fever, diarrhea, weight loss. Transmission is through sex, shared needles, and through placenta, through blood transfusion. Prevention is avoiding drugs, avoid having protected sex, sterile needles, and through primarily by counseling. So these are the things regarding the human health and disease, the two major causes, AIDS and cancer. That's it. Thank you.